we have two functional symmetries. In this case, we have the symmetry for patellar ligament. We compare the medial and lateral head of quadriceps. The symmetry is 90%, which is okay, which is actually quite good. And we have the symmetry between quadriceps and the biceps femoris muscle. The symmetry is just right on the edge of, acceptable, because the thing is, he has a quite fast hamstring, not hamstring, sorry, quadriceps, especially the muscles around the knee here, so the medial and lateral one. The rectus also, according to the reference values, is slightly faster, as you will see later on. This biceps femoris is just slightly slower. So when we go down, this looks quite empty because we have no lateral symmetries and only a couple of functional ones. When comparing the speed of contraction, you can see that all four muscles. So okay, I would say they're all quite. None of them is really slow. What you would like to see, you would like to see everything in green. You see the lateral head and the biceps femoris are just slightly over, and we are talking about 1 or 2 or 3%, so still okay. And for the tonus, here we have one stiff muscle and one loose muscles. We have two which are more or less just right on the average. So what would that mean? That as a recommendation, at the end, you would have, for the muscles which is too loose, you would have strength exercises in order to tone up, and for the muscle which is too stiff, stretch or relaxation treatment or exercise to release or to reduce the tonus in that particular muscle. Of course, you also have the text in order to support that, and that's it. Like I said, that's just a limited number of muscles, so that's why this kind of report looks a little bit short, but in most cases, when you measure 20 muscles, you saw the full report and you see that the data that you get is even more useful. So, for example, if I would do the same 4 muscles on the other leg, I would also have the lateral symmetries calculations, so you could also have some additional recommendations based on that, because right now, what would be interesting to see if the same 2 muscles are also, too loose or too stiff on the other leg, because then you can find out why these properties are not within the range that you would suppose to. So he said that he did some hamstring exercise yesterday. Usually the thing is, that shouldn't be a factor. If you have a increased tonus, it shouldn't be because just of the last exercise. Of course, if you do it immediately after an exercise, that will affect the results. But if you measure, 1 day after what is considered a normal training program or training session, it's usually a property that is there for a long time. So he has these muscles probably hypertoned for a longer period of time, not because of the yesterday's exercise. Why I'm telling you this, because sometimes, if you're working with athletes, you cannot always determine, that you will do the testing, first thing in the morning when you have no effect on the muscle function at all. Of course, these are the perfect circumstances, but in most cases we did the measurements, after the training, but if you wait about 30 minutes after the training, the effect on the results will be gone. So you can easily do the measurements and consider those results valid. If you would do the measurements immediately after the training, probably some of the properties would change. So this is just where to position this measurement in. But if this is your intention, then of course you would measure immediately after the training. So this is how the measurement looks like. Again, you don't have to use this report. In most cases, the researchers, they just take the raw data, which is generated the same way. And what you get for each muscle, you get a separate column. So you have all 5 parameters here. You also have, this amplitude is the amplitude of stimulation, so how many milliamperes was used on the last measurement. And then you have 1000 rows for each millisecond. So I didn't explain that before. So we are monitoring for 1 second what's going on. So that's 1000 milliseconds. In most cases, everything is over at 350 milliseconds, but sometimes it's not, especially with the lower back issues, it can take 700, 800 milliseconds for the muscle to relax. So this is, something that can be also used, for analyzing the data. You can also have a choice to export everything in TXT, so you can import it in some other softwares that you use for statistical analysis, and all results are immediately available.
From your experience in practice though, you probably don't do somebody's whole body. Like if you're working with a football team, you probably know they have a hamstring injury, so you probably just do the 2 legs. Is that right?
Yeah, so after an injury you focus on the problem area, but when monitoring, it makes sense. If you want to see how the biceps femoris recovers after an injury, you will focus on that muscle. But what I would suggest is immediately after an injury, you also measure the muscles around, because sometimes the problem why the injury actually occurred is because there is asymmetry with some other muscles. For example, you have fast quadriceps, you have slow hamstrings. So if you measure the quadriceps also, it can give you, some answers about why the injury actually occurred. So, or you go, at least, one joint up or down, because sometimes you can have a problem not in the area that was actually injured, so the cause is somewhere else, and maybe you can use the TMG to determine that. So I would say that for the first measurement after an injury, a little bit more than 1 muscle group. So if we're talking about hamstrings, at least I would also do the quads. So 4 pairs, 8 muscles. But when you monitor, you just go left and right, hamstring, and that's it.
Someone asked a question about what are the things that cause errors with the system, and someone had brought up the idea if someone has a lot of fat.
Yeah.
Could you talk about that?
Yeah. So if the thing is, if you have the fat in reasonable amounts, it will not affect the measurement at all. So the thing is, if we're talking about the response of the muscle, when you press this sensor tip against the muscle or the skin, the fat tissue will also be compressed, and when the muscle moves, this distance will not change. So you will actually monitor the response of the muscle. But if you have really a lot of fat, especially when you're measuring, even if you have a lot of fat on the legs, you still get the results that are normal. But it will be difficult if you would measure your obese person. You would try to measure lower back muscles, and if you have, let's say, 10 centimeters of fat, then you have 2 problems. The electrical field will just stimulate everything, not just the isolated muscle that you want. So the whole area will, all the other muscles in the core will contract, and you will not get this outward movement of the muscle belly. You will just get, you will see that something is contracting, but you will get almost no response. Even sometimes you will get a negative curve. That would be in the case in which the fat is the factor that will prevent you from getting the result.
Is that theory, or is that something you've experienced?
I've experienced.
And Does that fat cause an issue for the electrode stimulation as well?
What do you mean?
So for example, if you're trying to stimulate muscle and you have a lot of fat,
Yeah.
then you have to turn up the stimulus.
Yes, sure.
But does that cause problems as well?
No, no, because it's, you know, the thing is, it's all about how much current, so how much electrical field actually, you know, reaches the muscle. So if you have a current which is too low, you will not even get to the muscle and nothing will happen. And, you know, no discomfort will be caused about that. So it's all about, you know, how deep the electrical field will penetrate. On the other hand, like I said, if you use too much for thin muscles like sternum lateralis, then you have to be careful not to overdo it. On the other side, not because it would be unpleasant for the subject, but you will stimulate more muscles that you want to, and it can, you know, somehow affect the data that you're getting. So this is just a factor that you have to, you know, take into consideration when